So surgery is, you don't have to rely on anybody. The tooth's out or it's in. There's still a responsibility from the doctor and the patient to be on the same page. There's a lot of swindlers out there. There's a lot. And that's why I give so much content on for free, because it's like, I want you all to have the skills without having to be like, man, I got duped. Because there's a lot of snake oil salesmen out there. You give them the informed consent, good, the bad, and the ugly, and the patient feels like the doctor cares. What's going to happen is that treatment is going to be more readily accepted.
Welcome, everyone, to another episode. We've got Dr. Jared Williams with us today. He's a third molar extraction expert, a lecturer, an author, clinical assistant professor, and he's across the pond in America, Houston, and he's going to be giving us some insights, his perspective on what you can be doing within dentistry when it comes to minor oral surgery. I'm really excited to hear what he's going to say today. But no, thank you, Dr. Jared, for being with us today.
Absolutely. It's a pleasure and an honor to be here with you.
Yeah, so I mean, just give us a bit of background into, yourself. How did you get into dentistry? What's it like just living in Houston as well? Most of us are in the UK, so that's of interest to us.
All right. So I guess, living in Houston is nice. I'm born and raised here in Houston, Texas, United States. But I've traveled a good amount. I mean, I did my undergrad in Huntsville, Alabama, which would be Oakwood University. It's a small liberal arts, Seventh Adventist private college university in Huntsville, Alabama. I don't know if y'all have heard of Eric Thomas, hip hop preacher. Yeah. So we went to the same institution there. So there's that little common bond there. The interesting part, when I was at Oakwood University, seems like a lot of greats passed through that school. I don't know if y'all did any research. But when I was there, my goal was to be a dentist. However, my focus and attention wasn't doing the schooling. And so when I was there, I had a C- average, a 2.46 GPA. And so, but I had the aspirations, the goals of becoming a doctor, but my work ethic was not lining up with it at all. And so, I had to look myself in the mirror and make some really challenging decisions. And so, being at Oakwood, I had to, look myself in the mirror and say, hey, what do you really want to do? I knew I wanted to be a doctor. I knew I wanted to be a dentist. But, starting off was really challenging. However, I decided to call my dad one day, and him being an Army Ranger, somebody who knows how to kill people with their bare hands, it was very challenging to make that phone call, because I did not want to make that phone call in Huntsville, Alabama, and make that call all the way down to Houston, Texas, because I feel like his hand would reach through the phone and start choking me out. But I realized that in order for me to go to that next level, I had to humble myself and really ask for help. And so since, the logical explanations reach out to my folks, I decided to do so. And so after reaching out to him, he gave me some really profound advice that I still apply to this day. And he said, just get with the smartest person in class. That's it. And so after having a 2.46 GPA and understanding what it's like to be at the bottom, all the students who have 4.0s, all the students are getting honors convocations, walking around the stage with awards. I was just like, you know what? Let me follow this advice. And so long story short, after graduating college, after getting through dental school, I was just like, this advice really works. First time didn't have to repeat any tests or exams. And so long story short, I was just like, you know what? Following the smartest person in class really works. And so I decided to marry that person. So that's my wife for 12 years. So
I love that one. Really... if you want to get through, school, dental school, hey, marry that person.
That's it, baby. That's it. And so, that has been the single greatest advice that I could say my dad has ever given me, because it's allowed me to get to this point. And so, now that now that I lecture and I train, and on my practice side as a concierge dental surgeon, I just, as a general dentist, I just do implants, third molars, and IV sedation, and I just go to different offices traveling. I've been doing
Okay.
that for been practicing for 12 years, but doing that for the last 8.
Okay. So
So
before we get into that particularly, I just wanted to ask: is anybody in your family within dentistry? So it sounds like your dad wasn't. Was it your mum or other family members? How did dentistry become an option for you?
yeah, so great way you picked that up. So my dad, he was not, he was entrepreneur, and my mom, she was a teacher, retired teacher for the last 30 years in the public school system. And so I guess now that you asked me that question, it's interesting. My dad was an entrepreneur. My mom's was an educator until now. I'm an entrepreneur now, educator. But no, nobody. My brother, he's a pastor. My other brother is in insurance, but neither one of them have had any type of the clinical. My middle brother, who's a pastor, has a PhD, but my other brother is not in dentistry. So
So who planted the seed?
that's a great question. Oh, so when I was around 12, somebody, I had braces,
Mhm.
and somebody asked me, "What do you want to do when you grow up?" And I was like, "Dentistry," just like that, just like that. And what I started doing is I started shadowing
Mhm.
any doctor. So I had black, white, Indian, Asian, Hispanic,
Yeah.
male, female, endodontist, oral surgeon, GP, pros, the whole nine. And that was something that just came to me.
Mm.
I believe in God, so I want to say the Holy Spirit just kind of just dropped that in my spirit.
Yeah.
And what happened was I just followed through. I went down the Rolodex at the time, and I just went down because we didn't have Google like that too much. We didn't have Google like that. So I just went down the Rolodex and I just started picking up the phone. I was like, "Hey, I plan on going to dentistry one day. Would you let me come in?" And
Yeah.
so I literally was able to get this insight at such an early age. And then
Mm.
that was the seed that was planted. So here we
Yeah.
are now.
It's crazy that you know whether you're in the UK or whether in the US, you're gonna have that. You've got to have that motivation and that persistence to you. Being proactive, calling people. It seems like that doesn't change whether you're trying to apply here in the UK or you're trying to apply over there. Because it's such a competitive process.
It actually is. It actually is. I mean, that's an interesting thing. It's so interesting being in the States. They make it seem as if everything is different on the outside,
Uh-huh.
but being a person who travels and like I said, my wife, she's Nigerian. Having that international perspective, it allows me to understand that now we're all the same. We're all the same. There's some little, we may eat different, our language may be a little different, but at
Yeah.
the core, we all have the same brain. Wisdom teeth still look the same. Like it's all the same. It's a lot. It's a lot of similarities. A lot of similarities.
How did you start to develop an interest in minor oral surgery and implants? How did that develop?
So going back to that, smartest person in class, like I always wanted to work the least, make the most, and then live a good life,
Mm.
right? And I wanted to be a doctor. I really didn't understand what that meant. I didn't have any, like I said, my folks weren't in had doctorate level degrees, and I'm the first in my family, I should say. I was first in my family who's a doctor.
Mm.
Now there's like 4 or 5 of us now, and
Mm.
I'm the youngest. So a lot of this stuff I was kind of paving the way, unbeknownst to myself,
Yeah.
and I just wanted to see who was the best at who was doing. So I literally put my like hump prostrate myself
Mm.
at the minds of great men and women and just sit there and listen and take it in. And that's where I am today. Like none of this stuff was just like an angel drop knowledge into my brain, and now I'm like,
Yeah.
no, it's just literally had to humble myself from two individuals who were the best in the business globally, and then here we are today.
Was that when you qualified or even during studies, you were going out and meeting individuals that were doing oral surgery, implants? When did you start actually connecting with these individuals?
Oh, this is high school.
Oh, wow. Okay.
Yeah, I mean, remember I said that when I was 12, it hit me,
Hmm.
and then I just started shadowing doctors. I mean, this is a lot of pre-COVID and all this stuff where we had all this other things you can do and a lot of these regulations, but I would literally be in offices. It's interesting. One of the doctors, so I'll be speaking at the Star of the South in Texas. It's like the dental convention here within the greater Southwest
Mhm.
region of Texas. And one of the doctors who is hosting me is a doctor's dad who gave me the opportunity to come and shadow him.
Wow.
It was interesting. Yeah, it's crazy. What happened was, one of the doctors, I called him. His name is Dr. Dave Collins. I got to give him credit, man. Dr. Collins, I should say. His son is Dr. Dave, but his dad is Dr. Collins. Um, he was the president of the American Dental Association here in Texas, one of the dental organizations here in Texas. And it was just like, hey, here's a block of wax and carve it.
Mm.
Now, at the time, I didn't have the skills of, finger manipulation, the dexterity, the instruments and all this stuff. And so I was like, give me a picture and I'll do the best I can. Now I'm in the back. He's seeing patients. He puts me in this room where his lab, and I'm just back there just carving stuff up, carving in high school. And so I just put it down on the table and go about my day, and I'm shadowing him some of the stuff. And it was so funny. Years later, 5, 6, 7 years later, my parents go to his office and they're like, hey, how's everything going? He was like, your son, he waxed up this tooth and he still remembers it like 5 or 6 years later. And like, this is like the common theme that they talk about.
Mm.
And I didn't know I had this skill. But it was something that he saw and I didn't know I had. And then, now the door that he opened for me, now I'm able to say, hey, he's the person that allowed me to get to this point.
Yeah, and it's come
So
full circle.
Absolutely.
Yeah. Okay, so what would you say is interesting to you about oral surgery, implants, that side of dentistry? Why not endodontics, or why not pediatric dentistry? What would you say is exciting for you with oral surgery?
So surgery is a fine, like, you don't have to rely on anybody.
Mm.
The tooth's out or it's in. Like, it's like, it's simple. The implants angled, wrong angle, or in the nerve, which shouldn't be, breaking through the lingual plate, shouldn't be. Like, it's a definitive science, and I like that. When you start doing pedo, I am an introvert. Like, I could turn it on if I need to, but
Yeah.
I'm an introvert at heart.
Yeah.
So the energy it requires to run around with children and the yelling and screaming, oh my gosh, like, that is not me. And I believe that God has given wings to all pedodontists, so all you out there, I praise God for you. Like, you guys matter. Like, you are excellent. I will give you all my patience, right? When it comes to endo, I had some really good endodontic professors. I just thought that from my mentorship, I thought that field was potentially going to wane because of the advent of dental implants. That was my thought. But when it comes to oral surgery, like, it pays the most. I was good at it, and a lot of my mentors did a lot of surgery. And so I thought to myself, you know what, financially it makes sense.
Yeah.
I'm good at it. And it's something that you can't, a lot of doctors do not like doing it. And so I thought to myself, is how can I position myself to where I could take advantage of a spot where it's a blue ocean, like, there's a book about that. Like, how could I take advantage of that opposed to trying to figure out all this other stuff where everybody's trying to hunt after it. So my focus is thermosurgery, not even implants.
So someone who's thinking of doing the same, what would you say are the key things in developing your skills in that respect? So I'm sure you've been on many courses, to refine your skill set and your approach to it. Can you cut down the journey you took?
Absolutely.
Sorry?
Absolutely.
Yeah. How would you advise someone who's now set their mind on oral surgery to then make the most of the development?
So, as a clinical assistant professor, like, this is I got my cap on, right? It's not just a random doctor. In the GPR clinics, before I became a clinical assistant professor in GPR, I would tell doctors to do at least a 1 year residency.
Mm.
Not because the residency is going to give you superpowers and you're going to be the super doc. Because I wanted to quit my residency after 6 months at University of Pennsylvania. Right?
Just explain the
Ivy League.
residency to us that are not
Oh,
too
I'm sorry.
familiar.
So, general practice residency is typically a 1 year 1 or 2 year hospital based residency that you will perform after you graduate dental school.
Yeah.
Or they have a AEGD, which is like a 5th year dental school.
Yeah.
And what it does is it just exposes you to all the fields of dentistry, opposed to just doing oral surgery, endo, pros, perio, pedo, so on and so forth. So what it does is just like a general year. And I say to all docs, if possible, do that 1 year residency. Now, after COVID, it's kind of gotten a little squirrely because, there haven't been too many patients returning back like they once were. But what happens is that when you do that 1 year hospital based residency, it gives you a lot of insight and exposure to very sick people. So it's not uncommon for you to, like, for instance, when I was in residency, it's not uncommon for me to reconcile 30 medications. I got to see 30 medications and be like, okay, I know what to do. Opposed to somebody's like 3 and like, refer. And so when it comes to blood pressures, cancers, bleedings, INR, diabetes, you know, like very sick patients, that's what it allows me to do with the GPR. Now, AGD, like I said, is a little different. You typically are away from the hospital and you're able to basically see more treatment planning, more cases. Because in dental school, typically you're going to see maybe 1 or 2 patients in a day and everything's going to be gift wrapped and they're like here. But in residency, it's just like, hey, you're basically starting off.
Yeah. So that
After you do
sounds
that,
like the equivalent of our. So we would qualify, and then you do a year of foundation training, which is like supervised year as a dentist, and then you can choose to do dental core training, which is based in a hospital, and then there's the different specialities. So it sounds like dental core training is the equivalent to the residency there. I'm sorry, I cut you off there.
No, you're good. You're good. You're good. This is your show, brother. I'm here for you. Nah, so after that, basically that core training, then I would say work for like a public health setup, and like which we call a federally funded health clinic. And basically what that is like you're serving the underserved for about a year or two, just so that you could refine the skills that you have that you learn in core training or residency. And then after that, then go out there and really try to put a dent in the system. What happens is a lot of docs, they get out of dental school and they finish their training without that residency, and they go from seeing 2 patients to 40. And it's sad because one of the main reasons why I teach the way that I do and I'm so passionate that I do is because I have a YouTube page and there's a video that I posted, and on a weekly basis, I have individuals saying that they have a surgeon or a GP end up causing them nerve paresthesias, and it's happening. As a matter of fact, that this one young lady, she said she wanted to commit suicide.
Wow.
Yeah. So it's no longer about, making teeth whiter, making teeth straighter, having less third molars. Now it's talking about, life and death. And we never were thought of, that it was something that we were never trained about or another perspective. But when and this is not even infection. This is like the lady had a bad experience and now she's like, hey, I want to commit suicide. I mean, I could, it's public. It's a real sad thing. So, my main focus is to give GPs, first off, let you know that imposter syndrome is real. Let's start there. Right. Let's start there. Imposter syndrome is real. Once we get over imposter syndrome, now I want to give individuals the keys to success so that they have success very quickly. And I'm not talking about, 4 or 6 months into training. I'm talking about like you apply, you get the results.
Yeah.
So
it sounds like from what you're saying there, the person that wants to take this route, you need to put the reps in. So you need to put yourself in environments where you can really carry out a number of cases, see patients that are medically compromised so that these things are not scary for you before you then launch into general practice doing this full time? Would you say that's about right?
Absolutely,
Yeah.
absolutely. I mean, because this is, I mean, the the injection technique that I teach doctors is like you're about a millimeter from the brain, right?
Mm,
10 centimeter from the brain.
mm,
Gal Gates, you're like you're there's so many vessels that are there. You know, you're doing a third molar, you could cause instant paresthesia.
mm,
If you do the wrong elevation technique, you could push a tooth in the pterygomaxillary space. You could put it in the pharyngeal space. You could put it in submandibular space.
mm,
You could hit an artery and patient die in the chair. Like a lot of these things are advanced surgeries.
mm.
And, you know, me speaking about them, I'm like, crap, this is a real big thing. I've just been doing it so frequently
Yeah.
and had success. But the reason why the success is there is because, you know, when you follow the greats, it's going to be challenging.
Mm,
Their advice is not always going to make sense, but the results are typically going to be spot on.
mm.
And so when an individual understands that, it's like, hey, same time it takes to cut a class two, same time to take out something called 7/3, they've done correct.
So let's talk about the beginner who wants to start taking out third molars. What are your top tips instead of the do's and the don'ts? What should we look out for? What should we stay clear for? So this is just for the beginner.
Number one thing, building rapport. It's basically having a friend. If you build a relationship with your patient in 60 seconds flat, they'll allow you to do anything to them as long as you don't hurt them. What happens is docs are so excited about either doing aligners or taking out thirds that they end up disregarding the living, breathing individual that's sitting right across from them,
Yeah.
right? And when an individual disregards that, one wrong thing that you do or the energy that you give off, the patient has a completely 180-degree turn, and then your treatment go down the hill, go down easily. And somebody who has Invisalign, who's been through that whole process, um, you know, there's still a responsibility from the doctor
Mm,
and the patient to be on the same page.
yeah.
And the moment that that rapport is not there, that communication's not there,
Mhm,
it goes down south very quickly.
mm,
And I would say that's the biggest thing because complications are going to rise across anything. Like
mm,
Google definition is just the complication is difficulty. And so you could have difficulty doing aligners, you could have difficulty doing third molar surgery.
mm,
That's going to happen. The way in which you get around those complications or those difficulties, having that rapport.
yeah.
If I let you know that I'm going to take out your thirds and you realize that there's a likelihood of you having a paresthesia,
Mm,
you're going to understand that, hey, he told me about it or she told me about it. I can prepare for it. Now, if it doesn't happen, praise God.
yeah.
But if it does happen, I was told prior to.
Yeah.
When the questions are asked about the paresthesia as a patient side and the doctor's explaining it to them on a third grade level, not because the patient's stupid, but because they don't understand horizontal impaction, mesial angle impaction, complete bone impaction,
Mm,
the maxillary sinus, all these big words that we've come up with and we use on a daily basis and take for granted to speak to a patient, it's going to be challenging.
mm,
And so when you give them the informed consent, the good, the bad, and the ugly, and the patient feels like the doctor cares, what's going to happen is that treatment is going to be more readily accepted.
yeah.
And so when you're able to just break it down in that fashion, your patients are going to be more inclined to accept your treatment. And so if you are new, the first thing that you're going to have to do is build rapport and then get a patient numb.
Mm.
You know, even me, it takes me some time to take out thirds, but I'm seeing more complex cases
How
where,
are you building rapport? What are some go-to questions or things you might ask the patient to build that rapport? You talking about the weather? What are you doing?
I got you. All right. So when I come in the operatory, it's a science, right? So when I come in the operatory, I don't have a lot of my dental gear on. I have my scrubs. I'll take my mask off, and as soon as I come in, I say, "Hi, I'm Dr. Williams. How can I help you?"
Mm,
What I did right there, as soon as I smiled at you, you smiled at me. It's
yeah.
called a mirroring technique.
Mm,
When I smile at you, you're gonna smile back at me.
yeah.
There's a mirroring technique in our brain. So right now I'm playing with your mental chemistry already.
Mm,
All right. When you do that, it switches the switch off in your patient's brain that they're like, okay, okay. So when you walk in instantly, hitting them with that smile, they're going to reciprocate that to you. And then now we're on the same page.
Mm.
Then from there, when you look at, hey, how can I serve you? What you're doing is you're putting yourself in a position of deference. So you bring yourself down and lifting the patient up.
Mm.
When you do that, people are typically going to want to give you more information.
Yeah.
But if I come into the office, I'm looking down at you,
Mm.
what's going to happen is you're not showing me deference. And so typically what I'll do is I'll come into the operatory and I'll bring my chair a little bit lower so they're higher than I am.
Mm.
And so what I'm allowing them is to have that superior position and I'm in the lower position. I'm giving them the feel as if they're in control.
Yeah.
And if somebody feels like they're in control, they're going to be more forthright with information.
Yeah.
Now, this is coming from one of my mentors, Chris Voss, who's a hostage negotiator.
Mm.
Great book, Never Split the Difference. You should look into it. Once I do that, then what I'm going to do is this. I'm going to explain to them their treatment in a show tell approach. I'm going to use third grade language to explain to them everything that we're doing.
Mm.
So if I say, hey, Miss Jones, if you see this tooth right here, it's close to the nerve. The reason I'm bringing it up is if the nerve were to be disturbed, there's likely to have a numbness in the area. So I don't say nerve damage. I don't use any words that have any type of anxiety attached to them.
Mm.
When you use words that are simple, easy to understand, and you have zero anxiety, most patients say, okay, and move forward. What happens is they'll say the nerve will be damaged,
Mm.
like disturbed. It's kind of like if you're using your cell phone and somebody's like, we're sorry, the service that you have is just taken is temporarily out or disturbed for the moment.
Yeah.
You're like, okay. But if it's like, hey, it's damaged, you're gonna think like, oh crap, man, I've been paying $100 every month, and like, what are you doing? You know. So it's little things like that, and making sure that they understand. And then, lastly, just making sure that they see everything that's going on.
Mm.
And when they say, hey, is there gonna be damage? Just let them know, hey, it's a possibility. And if it does happen, you're the lucky one.
Mm.
And not to be cold, but to be straight up with patients, because the moment you lie to somebody and they find out, trust is gone forever. And so going back to that building rapport, getting a friendship, anytime you have a relationship, it lives and breathes on communication, the
Mm.
good, the bad, and the ugly. And sometimes giving individuals negative information that's truthfully about their situation is better than not giving them that information at all.
That's good.
And that is a game changer,
Mm.
because you would think that, hey, if I tell them there's going to be nerve damage, they're going to say, no, I don't want to see the procedure.
Mm.
When in actuality, it's the opposite. The more you give them, the less they're inclined to say no, because they believe that you're trustworthy, you're not hiding anything. And if something happens, you're competent enough to either take care of it or put them in a better situation so it can be taken care of.
That's good. So from what I'm getting there, building rapport, so vital. Make sure that you're talking with the patient, put them a little bit higher up, you be a little bit lower in the chair. Don't be in a rush to just lie them back. and
That's a disaster.
Yeah.
That's a disaster.
Yeah.
That's a disaster.
And then you also talked about local anesthesia, how that's also key. Because I guess for patients, they're thinking, third molar removal. I've heard scary things about it. Pain. People talk about pain. So how do you deal with pain management and communicate that to the patient?
So I'll just let them know. Excellent question. I'll say, hey, and they say, hey, am I going to be in pain? I just say, hey, after we get you comfortable, only thing you'll feel is pressure. And I'll actually put my hand on their shoulder and just press like this hard. Firm, I should say. I just shut up. It's kind of like the less you say, the key targeted words you say, the more individuals are going to be open to you. The more you talk, I don't know if there's any used cars salesmen on here that's going to listen to this, but the more you speak, the more somebody's like, I don't know about this one.
Yeah.
Just answer their question and shut up. So if they feel pain, if they say they're going to feel pain, say, hey, I'm going to get you comfortable. And after I get you comfortable, only thing you feel is pressure. I didn't say after I get you numb, after I give you the needle, after I get you some lidocaine.
Yeah.
Say after I get you comfortable. There's no anxiety with comfortable being saying that word. And so, they're perfectly fine. The challenge is this, is that after they get the patient comfortable, the patient's still not comfortable. So we got to brush up on their local anesthesia technique and I wrote a book on it, How to Get Any Patient Numb, third molar edition. And it really allows somebody to understand the psychology of a patient, but then also give them practical tips on how to comfortably and predictably get the patient numb.
Mm. So
And I really focus.
I want to get into that a little bit more in terms of getting them really numb, because that's across the board, all general dentists. It's something we need to be good at doing. How do you handle the patient who's had previous traumatic experiences where they might not be settled by you just saying that um, you're going to be comfortable afterwards? How do you deal with that patient who's had previous traumatic experiences?
Good question. I just address it.
Hmm.
Like if I see a patient that's kind of like one of these, I'll say, "Hey, how can I help?"
Hmm.
And they'll be guarded. And what I'll do is I'll say, "Hey, did something happen? It seems like something happened in the past."
Hmm.
Keyword. You asked me for keywords. Say it seems like, it sounds like, it looks like. Just ask the patient. It seems like you had a bad experience in the past, and then let them talk.
Yeah.
And they'll typically give you what nobody's ever asked them, because nobody ever cares. They just say, "Open up, let me get your number, keep moving." And I love that approach because I learned so much from my patients. Oh my goodness. So typically, so you asked a question earlier on. You said, "What do I say to my patients?" I say, after I ask them, how can I help them? After I go through everything, I say, typically my patients are going to be, you know, third molar age of 15 to 20. I ask them, "Hey, where'd you go to school?" I'll get information from them from that way, like high school, that is, not college, because not everybody goes into college, right? And so if they graduate high school, I'll say, "Hey, what'd you do? What'd you do after school?" I don't say, "Did you go to college?" How many people care about going to college nowadays? So I say, "What'd you do after school?" And I learned so much. Like, and if I see that they have a nice shirt on, if I see they have nice glasses, I'll say, "Hey, that looks really nice." Like, these little compliments go a long way, because most people don't care. Like, we live in a day and age where it's just like, if I'm not in my device, I really could care less about you. And so when you give somebody an honest, true compliment about what they are and what they do, it changes everything. Like, if somebody's an artist and say, "Hey, I do art," and I'm like, "Yo, let me see what you do." And I look at them on Facebook, on Instagram, I'm like, "Yo, this is really good." And so I like the amount of information that individuals give by just inquiring about the individual.
Yeah.
It's a game changer. There's a book that says how to win friends and influence people. Like, if you care, the most interesting person is the person that you're talking about. Nobody cares about you. Like, everybody, like, nobody cares about you. Nobody cares about you. But the moment that you want to go to the top is caring about other individuals and like really taking care of them. And so I just say, "Hey, like, I like what you have on. I'm nothing. I mean, I'm married, so I'm not doing those.
Yeah.
But like, keep it professional, and make honest comments about what they're doing, and some of the things that they're doing, and they'll just break down and give you all the information. I'll give you this one scenario. I was teaching our hands-on life course, and all my patients that I treat none of them are, I've never seen them. Like, anytime I do a case, like, I have my team treat and plan them, and then I'll come and do the surgery. So I've never seen you a day in my life, never looked at your x-rays. That's just how I operate. So I'm doing hands-on live course, and I have these docs that flew in. They're ready to do this training. And so as we're doing the training, this lady, I walk in, she's like maybe 25, female, and I'm just like, "Hey, how you doing?" And she's super fearful. Like, her eye, you can see the whites of her eyes, and she's doing one of these. I was like, "Oh gosh." I was like, I just I was trying to show them to do thermal surgery, go home. I was like, "I don't need this thing." So she's doing one of these, and I'm like, "Oh, okay, gosh, let me take care of this, guys." So I come in and I say, "Hey, how you doing? What's going on?" She's like, "I'm just here to get my wisdom teeth out." And I was just like, "Okay, tell me what's going on." And so she's like, "I've been in pain, and I don't know if I should be here." And I was like, "Well, nobody's holding you. You're more than welcome to leave. Like, you can go respectfully." And she was like, "No, I want to be here." That's another key. I want to throw that out there. Giveaway. Pick up your bag and let them go. And most people want to say, the psychology of it is like, "No, I want to stay." So I gave her that out. And she was like, "No, I want to get my teeth out." I was like, "You sure? Because it seems like you don't want to be here." And she was like, "I don't, but I need to get these wisdom teeth out." I was like, "Well, can I serve you?" She was like, "Yeah, deference there." So she was like, "Yeah." And so I went over the whole case, and I was just like, you know what? We're gonna make sure you're nice and comfortable and do everything we can.
Mm.
Touch her shoulder,
Yeah.
transfer that energy, allows her to be at peace. I give her my warm energy, and then I lower my voice like a FM DJ voice, and I
Yeah.
say, hey, we're gonna make this right, and we're gonna make sure we're all on the same page.
Mm.
And then I say to her, I was like, so where'd you go to high school? I went through that, and I was like, so what'd you do after college? She was like, oh, my dad's in trucking. And
Mm.
at the time, I was dabbling in trucking myself. Now I started naming off some trucks, and she's like, oh, you're into trucking as well? I was like, I know a little bit. And after the procedure, she's wanting to give me hugs. She's wanting to give me her contact to her father's information.
Mm.
And so I took her from an anxiety scale of 12 down to a 2 in less than 60 seconds flat. She's taking pictures and we're having a good time.
Yeah.
And so that's an example, a quick example, verbatim on how you break down a patient from having an extreme anxiety all the way down to a 2. And then they want to share with you everything.
Yeah.
And so patients, they're just people. Like at the end of the day, like they're just people. And sometimes we as doctors need to get out of ourselves and believe that we're no different than, fast food workers.
Yeah.
Which is like we're just glorified. We just make a little bit more money, right? We got the student loans. And so but when we understand that it's all about service,
Yeah.
like people want to be served. And when you serve people, you're gonna, everything's just gonna work itself out. You're gonna get exactly what you want.
Yeah. No, that's awesome. I think anyone listening to this has no excuse for not being able to build rapport after listening to that. That was a masterclass in how you can achieve that. Talk to us about techniques, or better yet, how we can improve our technique when it comes to giving LA.
I was gonna thought you asked for instruments. I was gonna show you some instruments. I'll put these down.
Oh, feel free.
All right, I'll get to it. I got it right here. So, number one thing is this. So I got the book in the back. You can probably see it. How to get any patient numb.
No, I can't see it. Able to?
Oh, you can't see it?
Sure. Yeah. I can always put the link in the description as well.
Right here. How to get any patient numb. Right here.
There we go. Right. Yeah.
And so it's a book, really straightforward book, and it gives you my exact technique. It has videos in here as well. And it really shows doctors on a simple stage, on a simple path on how they could, get patients numb. One of the main techniques, and I'll drop a little gem in here, is Gal-Gates. Gal-Gates injection. It's very similar to Varenicki Akinosi because it hits the notch of the condyle, the neck of the condyle. The goal is to, excuse me, can I give you a couple of more gems?
You're taking me back to dental school. The thing is, I've heard and studied these, but never been brave enough to actually attempt them. So you'll also have to tell us, how do we build ourselves up to actually performing them on patients as well?
All right, so I'm gonna give you. I'm a giver. So when you do the Gal-Gates, typically you want to do is have the patient open as wide as they can and aim for the neck of the Put your finger on the tragus right here. Open up as wide as they can. And just pretend like you're gonna hit your finger. So open as wide as you can, and bisect and just go and hit your finger. Go out with it. The main goal with local anesthesia is going to be aspirating and injecting. So there's this guy, very profound. He lied to us. Dr. Malamed, right? Oh my goodness, right? Dr. Malamed. Y'all heard of Malamed, right? In his book, you never heard of Malamed? You got local anesthesia king. What? Nah, you've heard of him. Y'all know about Malamed. Anyway, he's like on everything. Well, Malamed, he said you're supposed to give a carpal of local anesthesia over 60 seconds. Because what happens is, like I said, because what happens is you are spreading the fascial spaces like this, right? And those tearing, it elicits a painful response, and pain, C fiber, you're going to have a response to it. But what happens is that when you give that pain medication, the reason why I say it's a false is because if I give 10 injections over 60 seconds, that's 10 minutes of sheer pain, typically, right? Giving a Gal-Gates pinch out, 1,000, 1,000, that's a lot. So I typically would give a full 10 injections in over 60 seconds. Yeah. the main thing is this: you got to aspirate and inject. As long as there's nothing red coming in your carpule, then you're good.
Yeah.
And what I do is I like to do a distraction technique where I'm actually shaking their jaw. I go real in depth in the book. And by shaking their jaw, you can't determine the difference of pain versus vibration. So going back to neuroscience, the C fiber goes up slower than the vibration goes up slower than the vibration. So if you were to go to your son or daughter or your spouse and do one of these, and then with your other finger pinch them, they can't determine the difference. So if you were to pinch yourself and then shake, you can't differentiate it in your brain. So now we're starting to mess with their brain chemistry that they can't even determine. So I'm shaking, I'm giving the Gal Gates, they're not going to feel it. And that's why I could drop 10 injections in 60 seconds because I'm aspirating, which means I'm not going in the blood vessel. That's all that really matters. And then I'm also disturbing or disrupting their brain to where I'm vibrating, distracting, and I'm giving an anesthetic.
Yeah.
That's number one. Two things dropped on me. Another concept I like to talk about is a shotgun approach. So anybody that gets a lower filling, extraction, SRP, crown, endo, give a Gal Gates. And so I go with the shotgun approach. So bupivacaine doesn't have any type of low epinephrine in it, right? So if you ever shot a shotgun, it has pellets. So when you shoot, pow, it goes like this. It wafts out. And so when you do a Gal Gates with a bupivacaine, no epinephrine in it, what it does is it wafts out into the area. And when it wafts out into the area, the goal is to eventually take out that the V3, which is the the mandibular branch of the eye end, right? When you do that, it wafts out. Then you follow it up with a sniper, which is lidocaine. And that lidocaine will just go into the spot. It has epinephrine, so it has vasoconstriction. So wherever you put that medication, if you're off, then that medication will not penetrate where you are. Does that make sense?
Okay.
So you go, pow. So if you have let's just say the JW on my shirt, if the goal was to get in between, hit the J, but I use a shotgun, if I use a sniper and I'm sitting over here, I'm missing the mark, I won't be able to hit the J, right? So that's what a lot of GPs do. They'll start, and surgeons as well, they just start using lidocaine and they just hit shooting around. And they're like, my patient's not numb. Let me just go through the procedure anyway. No, clown. Let's not do that. Let's not douse the patient. Let's not douse them with medication because all you're going to do is have a local LA emergency, right? And so what you do is you use that shotgun approach and you go, poof, and it goes into the area. And one of those buckshots are going to hit. But then you follow up with lidocaine, which keeps the epinephrine in the area. So both those medications are working synergistically, and you have a profoundly numb patient. Wow. And that right there is something that most people don't do. And especially if somebody is infected, that bupivacaine is going to work so much well because the acidity in the bupivacaine is going to be so low. Yeah. And then we can start going all the way down. And that's what we talk about more so in the book. And so it's just that type of thought process that people use. Because I've sat and watched surgeons and they'll just use lidocaine or septicaine. And that's a sniper. And so you better be a good shot. But using the shotgun approach, what it allows the individual to do, even if you're off a little bit, you'll still be able to, get the patient profoundly numb.
So you said that's your approach across the board, in that you'll go in with bupivacaine first and then a lidocaine shortly afterwards in all cases.
Right after all cases. It doesn't matter what it is. I always give them a Gal Gates. Always. And so think of it like this. The reason why, because I'm really big into like the whys. Right? I believe if you have the why, then you can do anything. So think of it like you were going to change the fixture of your light in your office, right? If you wanted to turn off the electricity, you wouldn't go to the light switch and just flip off the light switch. You go to the breaker box, turn all the power off in that region of your office, and then go in there and start tinkering around. But if you get some instruments like these and start tinkering when you flip off the switch on the door, you're going to the hospital or you're going to see your maker. One or the other. You're going in the ground. One or the other. So what I like to do is go to where how the creator made us and go to the breaker box, and that's the Gal Gates.
Yeah.
Go before the nerve bifurcates. And once you get it like that, it shuts down the whole side. And when you're able to do that, it's game time.
You've covered local anesthesia and rapport building. I really wanted to get the steps that you're going through, especially for people that just want to know what can we be doing tomorrow in clinic, um, to get better at this.
All right. So what you do tomorrow is this. You're going to get a 27 long needle, and you're going to start doing Gal-Gates injections on all your patients that have lower teeth that need to be taken treated.
Mm.
You're going to do the shotgun approach, and you're going to do the sniper approach. Shotgun goes first, and follow up with a sniper. And once you do that, then you're going to follow up with a long buckle with a septo, and you'll be able to rock and roll for all your patients.
And if we want to get some sort of example of the Gal Gates in action, is that on your YouTube channel? Where can we get like an example of this in action?
Yeah, I think it's on my YouTube channel. Yeah, it's on my YouTube channel. Definitely on Instagram, the JW Method.
Mhm.
I know if you kind of scroll in, you'll see a lot on there. I like to give a lot of free content because I know a lot of people are like, hey, I'm in school, especially if I'm a new doctor, new training. I got you covered. Yeah, just go online. There's a lot of stuff. It's all out of order, but you could. I put a bunch of stuff out there, so you'll be able to get that before you decide to make an investment, like a book or something.
Perfect. So, okay, we've covered rapport building. We've covered anesthesia. What else would we need to make sure we're on top of? If we're now, let's talk about just third molars. What should I be going for? What should I not be going for when I'm starting out? What advice would you give there?
So the advice that I would give them, I haven't done this before, but can I do this for you?
Go ahead. Yes, please.
So if they email me
Mhm.
at info@smileaftersurgery.com, I'll send them a resource so that they could see where they are in terms of beginner, intermediate, and advanced.
Okay.
That'll be a resource that they could kind of look and see, okay, that's where I am. I'm going to choose this case moving forward. And on that resource, it's different cases that I've completed, and it allows a doctor to know, okay, I could do this case because I'm a beginner. I shouldn't do this case until I'm advanced. And it's little things that you otherwise wouldn't see. And so I would start there. But the big thing is this: is if you don't, you need to trust your gut. Like I really take it back to who you actually are. Just because you're different than I am, your training is different from mine, and it doesn't make me better than you or you're better than I am. Like it's about who we are as an individual. I don't think thermal surgery performed by everybody because there's a lot of psychology that you get over in yourself, not even the patient. So if you feel as if, hey, I don't feel like I'm ready, I'm comfortable, then don't do it. Don't take on that case because you'll get into a disaster. Because certain things that look simple, if you're not trained or if you haven't studied, you're going to get yourself in a real big situation. And it's sad. And so I would do this. I would, number one, get free content, go on my go on my YouTube page. Go on my IG and just get all the free content you can. Like I said, I post religiously, even in the stories. And I'll show docs who their cases before and afters. I would start there.
Yeah.
That would be the best advice that I could actually give in this time frame. Just like trust your gut and get some education.
Yeah. No, I resonate with that because I just think about myself in that I'm not routinely taking teeth out just because of the type of patients I see. So I know, unless it's very mobile, far away from the major nerves, I'm referring to a colleague who is an implant dentist and he's taking out teeth regularly. So, and he's going to be much quicker at it. Patients going to be much more comfortable with them in that respect. So I guess it's about knowing your limitations and what's going to work well in your hands. Yeah.
Let me ask you this: do you typically take out tea?
Sometimes, yeah, I do.
Do you like taking out tea?
No.
You don't. I love it. I love it. I love it. Yeah, that's good. That's good. Yeah, I want to say it's just about knowing who you are. I mean, that's why for me, I decided to do thermal surgery because I hate cross.
Mhm.
I don't. I mean, the reason why I haven't even got into like all on fours is because like the little screws and then having to rely on the labs and the materials. Like it's just like, oh my gosh,
Yeah.
it's just a lot. But you got to know who you are. I
Mhm.
mean, that's a big thing. Like I'm real big on personality assessments. I'm really big on you know doing what works in your hands,
Yeah.
doing what makes you feel comfortable, doing what you like. Because at the end of the day, like there's so many people out there. Like in Houston, there's 6 million people.
Mm.
6 million people in the city, not in the state, the city, the city of Houston. So there's a lot of opportunities, and so I'm really big on just allowing the individual to understand that what you like matters and what you don't like also matters. And so
Mm.
just find your lane and just get into that. Like that's huge. Like I wouldn't be in this spot now if I were trying to do aligners. Like I
Yeah.
respect the individuals who do ortho. Like you guys are offering a phenomenal service. You're able to see some transformations,
Mm.
and you know there's a space for that, and y'all get paid handsomely for it, as you should, as, as you should. So it's really about knowing who you are
Mm.
and walking into that, and then finding individuals that make you feel comfortable. That when you ask questions, they're like, man, they don't make me feel stupid.
Yeah.
Like, is the information they give me, is it practical? And then are they following themselves?
Yeah.
Like I want to say, if a new doc is listening to this and like, hey, what do I do? Use that three-pronged approach. How does your mentor or mentors, I would say you get mentors, how do they make you feel? Are they practicing what they're preaching? And do they have the results and the information that they're offering is practical for you?
Yeah.
Um, I was listening to this one doctor, and he was talking about how all these older gurus on these stages are talking about the results that they're getting, but they've been practicing for 20 and 30 years. So they have special instruments and special financing that we who are young don't have.
Yeah.
And so that's disingenuous. I believe that if you can't give somebody the highest results with the basic instruments and entry,
Mm.
you're full of crap.
Mm.
Sorry, you're full of crap. And my goal is to like really give doctors that ability to have the results of the
Yeah.
best of the best because you can do it. Like I had a 2.46 GPA. Like I don't think anybody on here has ever had that. And if you had, then I want to talk to you personally and let you know that it's possible and do it at a high level. Like I've been doing this for years, and
Yeah.
now I've been lecturing and authoring and all these other
Yeah.
things that you could think of, and it's possible.
We're
It's
talking
possible.
earlier, and you've taken out a significant number of third molars. What's the number? Do you know the exact number of third molars you've taken out over the
I
years?
stopped counting after 10. Like, I mean, I've gotten up to 10,000, 12,000 last couple of years. I just stopped counting. I just kind of guesstimate now.
Yeah.
Only reason I bring up a number because they look at me like you're too young. You're not a specialist. So whatever. Like, all right, guys, let me here's a number. Throw it out there.
And
But
when would you say it almost became second nature for you, where you're not even really thinking, you're now what they call unconsciously competent? When did that happen for you?
I would say, and you want me to be really? You want to be real?
Yeah.
I would say maybe about 2 years ago,
Wow.
maybe a year and a half ago,
What was
a
the
year and a
change?
half.
What was there anything that was defining that happened, or is it just putting in the reps?
So no, it was what happened was this. I was doing surgeries, but I had this thing called imposter syndrome.
Hmm.
And that thing really screwed with my mind. And so before I realized that I had imposter syndrome, I would just kind of go about dentistry thinking, oh, everybody could do these cases. And I'm taking out teeth that are wrapped around the nerve and the sinus, and I'm in my own little box. And so I'm just like, oh, everybody could do this. Like everybody could do this. So I thought that what I'm doing wasn't a big deal.
Mm.
Like I trained so many doctors. And when I was on the other side of them doing surgery, I was like, the oh, what the heck are y'all doing? Just lay the flat. And I'm thinking to myself, like, oh, wait a second, this is different. So it was funny because one of my assistants, she was telling me how the other doctors in the program were doing a bad job because she got used to me just taking out teeth in minutes, seconds, maybe 30 minutes or whatnot. And she's like, anybody could do this. But then she was like, no, Dr. Williams, like, you're really good at this. And I was like, everybody could do this. Like, it's just 30 molars. It's not that hard. But I mean, after you do so many cases. And so I just thought that anybody can do this. That's a classic sign of imposter syndrome. Like you're working at a high level, you don't think that anything's going on. So literally within a year and a half ago, I'm literally thinking, this is just normal. But I realized, like, no, you're abnormal, Jared. Like, you're abnormal. Like, this is GPs don't do this. Like, this is not normal. Specialists don't do some of this stuff. So respectfully. And so it was just one of those things where I was like, oh wow, like this is different. Yeah. And so once I realized that, I was like, okay, this is something that I need to look at and realize that you're different. You have a gift, share your gift. And that's when I was just like, if something bad happens, it's not because of me, it's because of the patient. Mm-hmm. Respectfully. Mm-hmm. And, ever since I started thinking it from that perspective, that's when the light bulb came off. And so when I say a year and a half ago, literally a year and a half ago, because I wish somebody had told me this, 5 or 6 years ago. Like imposter syndrome was eating up my life. I thought I was getting lucky taking out these cases. Yeah. And I didn't really talk about it too much. But ever since I realized that, no, you're operating at a high level and everything changed.
No, that's good. I mean, you talked earlier about how you want to have, some mentors that really help accelerate your growth. How do you find mentors, or how do you find courses which are really going to be beneficial for your development? Because there's a million and one courses out there for dentists, and it can be hard to then decide which ones are going to move the needle in developing your skills. So any advice there?
Absolutely. So number one is reach out to them. If they treat you like you were treated in dental school, run away from them. If they're not if they can't like actually get on the phone and have like a 5-minute conversation, and I say 5 minutes because everybody's busy, but have at least a 5-10 minute conversation with you about to purchase a course over $2,000, don't take it. Like straight up, because now $2,000, $3,000 is like that range where like I could spend it and be okay, even if I'm a resident. But anything above that, if you can't get on the phone and talk with those individuals, it may not be for you, especially if you're new. Now I'm speaking to a specific audience right now. So with that being stated, like I would do that. I would check out all the resources that they have online. Yeah. I would look at their reviews on Google and see if it's not above a 4.0, walk away. And then, see if they're practicing what they preach. Right. And so it goes back to what I was saying before. Like, how do they make you feel when you have a conversation with them and they answer their questions? Are they practicing what they're preaching, and what is the social proof around them? Because there's a lot of swindlers out there. There's a lot. And that's why I give so much content on for free, because it's like, I want you all to have the skills without having to be like, man, I got duped, because there's a lot of snake oil salesmen out there. I'm at the dental school. I've been doing this for years. It sucks, but it's one of these things to where you really have to watch out with who you're going with, and because unfortunately that's just how dentistry is. And I'll give you this one other thing: dental school is the same exact way. Let's not get this thing twisted. Like, let's not get the dentistry did the same exact thing. They said, "Hey, I'm gonna take $300,000 here in the States, $300,000 from me, and I'm not gonna teach you ortho. I'm not gonna teach you thermal surgery. I'm just gonna get." So it is. It's just whoever has the best marketing.
Yeah.
But I would definitely say, like I said, if you can't have a conversation with somebody, if they don't make you feel good, if they don't tell it to you like it's real, and if they don't have any content that you can follow up with, it's probably not. Yeah. Look at the track record.
Yeah, no, that's good. That's good. I mean, we've taken away a lot from how to handle patients, LA techniques, imposter syndrome, and I would love to get even more, but I want to respect your time and everybody else that's listening. We might just have to do a part two to to get some more nuggets from you. But thank you so much for being on today. If people really want to get in touch, what's the best way? Email, Instagram? What's the best way to get in touch with you?
I would say just keep it simple. The JW Method on IG.
So, perfect. And I'll put
Yeah.
the link in the description as well for all those that are
Yeah.
listening. But no, thank you for your time today.
Hey man, it's a privilege. It's a privilege. I would just say this, if I may, if you are thinking about advancing your skills, do it. God has given you a gift to serve people, and if you think that you can't, that's the reason why you should.
Hmm.
It took me years to want to even reach out to individuals about a gift that I've had, and imagine how many individuals could have been blessed or used this information if I would have just got out of myself years ago.
Hmm.
And so for all those that are out there thinking, hey, I'm a male, I'm a female, I'm young, whatever the case may be, you have greatness inside of you. And when you realize that, your life will change. And so I just want to encourage all those individuals out here that had the 246s of the world, that the world needs you. There were some idiots that calculated your test scores wrong, right? And I just want to let you know those test scores mean nothing. There's greatness inside of you, and the world needs to figure it out. And we just want to see your greatness in action on the world stage. So that's what I just want to throw back out there, because I wish somebody would have told me that and really touched me early on. But now I get to do it now. So I'm being obedient. And one man's obedience is tied to a whole bunch of other people's successes. So that comes from one of my mentors. So I just want to put that out there.